The shoulder started hurting, let's see, it's been a year now since my surgery. So it probably started about March of 2021. And I just couldn't lift it the way I should have been able to, and my grip was not very strong. I could not reach up into a cabinet. I was afraid to hold dishes in my right hand because of the weakness. So I got a referral to Dr. Sasser because I wasn't getting better with the physical therapy. He gave me two options. I could continue or I could have surgery, and I told him that because of the fact that the shoulder was hindering my activities of daily living, I felt that I needed to have surgery. So I did.
With all these patients, we try conservative treatment first. You always need to try anti-inflammatories, sometimes injections, sometimes even a little physical therapy can be very beneficial in these patients. I tell them all the time that the good part about your shoulder is you don't walk on your hands, and so unlike having a bad hip or a bad knee where it sort of drives you straight to having surgery, we try the conservative methods as much as possible. With her, she failed conservative treatment, and so the need for a reverse arthroplasty is utilized when you do not have a functional rotator cuff tear. If you have a functional rotator cuff tear and you've developed arthritis, we can use more of a standard anatomical total shoulder, but in her situation, she lacked the rotator cuff, so she lacked the muscle support, and so we have to utilize the reverse shoulder. I've actually been performing reverse shoulder arthroplasties for greater than 10 years, and there's actually been quite an advancement. With this new shoulder that I'm using, we actually use computer assistance. We get a CT that formats the shoulder and creates a 3D model for me and allows me to actually template the shoulder to balance the shoulder by a computer model and utilize that computer model within the OR to allow for greater specificity and accuracy.
I went in on a Thursday, had surgery, and I went home the next day. And I said, I thought I would have quite a bit of pain, but he assured me that I would not, and I didn't. The orthopedic unit at the hospital is excellent. I was very impressed with the quality of care, and of course I just love Dr. Sasser, and I would definitely recommend this surgery to anyone because the recuperation time is much shorter. I was actually in PT probably 3 weeks after surgery, which is phenomenal. I have much better range of motion in that shoulder. Very happy with the results. I'm very pleased with Dr. Sasser. He has an excellent bedside manner.